All right, ready to dive into something kind of interesting? Average vaginal length.
Okay, yeah.
I know, maybe not an everyday topic, but
Right.
stick with me on this one, Corey.
Yeah. I'm with you.
I think there's a lot more to it than we think.
Definitely.
You actually sent this in,
Yeah.
a video from HealthyCast on YouTube.
Oh, cool.
So let's unpack what they have to say.
Okay.
You know, we all hear about
Right.
penis size all the time.
Yeah.
What about the flip side?
Right, yeah.
What's the science behind vaginal length?
Okay.
And I guess, why does it even matter?
That's a great question.
Yeah.
You know, our culture tends to focus so much on,
Right.
the visible.
Yeah.
And I think that leads to so much misinformation, anxiety
For sure.
about the parts we don't see
Bodily.
as often.
Yeah.
Yeah.
So, what does the research actually say
Yeah.
about average vaginal length?
So several studies have looked at this.
Oh, wow.
And they found that the average length is about 9 to 10 centimeters,
Okay.
which is roughly 3.5 to 4 inches.
Gotcha.
But this is important.
Yeah.
There's a huge range of what's considered normal, anywhere from 6.5 to 12.5 centimeters,
Wow.
or 2.5 to 5 inches.
Okay, so that's a pretty wide range.
Yeah.
So does that mean focusing on the average is kind of pointless?
Exactly.
Oh.
It's like comparing apples and oranges.
Right.
Each person's anatomy is unique.
For sure.
And what matters most is understanding your own body
Yeah.
and feeling comfortable with it.
That makes a lot of sense.
Yeah.
Speaking of individual anatomy,
Uh-huh.
the video also mentioned that the vagina is wider
Okay.
near the cervix
Yes.
and narrower near the opening.
Right.
Why is that important?
Oh, that's a great observation. I think it speaks to the incredible design of the vagina.
Okay.
Think about it. It needs to be able to accommodate a range of experiences.
For sure.
From the insertion of a tampon to childbirth.
Right.
You know.
Okay.
Pretty amazing.
Ooh, I guess then, the big question, why does any of this matter?
Right.
We've got this number for the average length, but what does it actually tell us?
Honestly, not a whole lot.
Really?
I think one of the biggest myths out there that vaginal size directly correlates to sexual satisfaction.
Oh, yeah.
For either partner.
I've definitely heard that one.
Yeah.
But that's not actually true.
Nope, not at all.
Okay.
The vagina is incredibly dynamic. It can expand both in length and width during arousal.
Wow.
So
it's more about adaptability
than a fixed size.
Precisely.
Oh, okay.
And that adaptability is really a key factor in sexual pleasure and comfort.
Yeah.
You know, to anyone listening who might be worried about their vaginal size, take a deep breath.
Yeah, good advice.
Variations are completely normal and shouldn't be a source of anxiety.
That's so reassuring to hear.
Yeah.
I know, so many people,
Right.
myself included, have felt that pressure to conform to some, imaginary ideal.
Yeah, right?
Yeah.
Absolutely.
It's great to have those myths busted.
Yeah.
Speaking of myths, the video also addressed this idea that having more sex makes the vagina looser.
Right.
Can we talk about that for a second?
We absolutely can, and we should.
Okay.
That myth needs to be retired permanently. You know, in my practice, I've seen firsthand how much anxiety this misconception causes.
Wow.
It's really unfortunate. So what actually causes vaginal laxity if it's not about how much sex someone has?
There are a few factors at play.
Okay.
Genetics are a big one. Some people are just predisposed to having more lax vaginal tone.
Gotcha.
Neurological conditions can also impact it, as can pelvic floor disorders and hormonal changes.
Interesting.
Especially those related to childbirth and menopause.
So are you saying childbirth and menopause can actually change the length?
They can have a slight effect.
Interesting.
Yes.
Okay.
But we're talking about very small changes, usually just millimeters.
Okay.
Really not something most people need to worry about.
Okay, that makes sense.
Yeah.
It's interesting, though, that something like childbirth can have a lasting impact
on the body.
Right.
What happens exactly?
So during childbirth,
the
the muscles and tissues of the vagina stretch significantly
right
to accommodate the baby's passage.
For sure.
And afterward, those tissues may not fully return to their pre-pregnancy state.
Gotcha.
Which can result in a slightly looser feeling.
That makes sense. But you said it's usually a very small change, right?
Right. And importantly, age also plays a role.
Okay.
But again, we're talking about a tiny decrease over decades, like about 0.08 centimeters per decade.
Wow.
To be
precise.
Tiny.
Yeah.
Yeah. Okay.
It's really not as dramatic as some people might think.
It sounds like focusing on these minor changes can actually distract us from what really matters.
Yeah, you hit the nail on the head. It's all about shifting our perspective.
Yeah.
Instead of getting caught up in these tiny details, we should be focusing on what brings us pleasure and connection in our intimate lives. Yeah, I think you're right.
Okay, so aside from childbirth and aging, are there any other factors that can
it's a good question.
Influence vaginal length?
There are a couple more things to consider.
Okay.
Research suggests that height and weight can have a subtle influence.
Okay.
Taller and heavier women tend to have slightly longer vaginas.
Oh, interesting.
On average.
It's amazing how interconnected all these things are.
Yeah.
And the video also mentioned something called tenting.
Yes.
What is that exactly?
Ah, yes, tenting. Yeah. It sounds a bit mysterious.
Yeah. Yeah.
But it's actually a pretty straightforward physiological process that happens during arousal.
Okay. I'm all ears.
All right.
Break it down for me.
Imagine this.
Okay.
As you become aroused, your uterus and cervix actually lift.
Oh, wow.
Upward and backward. Kind of like a tent being pitched.
Gotcha.
This creates more space within the vaginal canal.
Okay.
Effectively lengthening it by an inch or two.
Wow, that's incredible.
Yeah.
I never knew that's how it worked.
It's pretty cool.
Our bodies are so cool.
They really are.
Yeah.
And tenting is just one part of the story.
Right.
Remember, the vagina also widens during arousal.
Okay.
As the tissues relax and become more engorged with blood.
So it's really a dynamic process designed to create space and accommodate whatever comes its way.
Exactly. It's all about adaptability and creating a comfortable and pleasurable experience.
Okay, one last thing I wanted to touch on.
Yeah.
The video mentioned Kegel exercises and pelvic floor physical therapy. Yeah. How do those...
Yeah, that's a great question.
Fit into all of this.
Remember when we talked about vaginal laxity?
Yes.
And how it can be related to weakened pelvic floor muscles?
Yes.
Well, Kegel exercises and pelvic floor physical therapy are all about strengthening those muscles.
Yes, sure.
They can be really helpful for a lot of women.
So you're saying that even if someone is predisposed to having a more lax vaginal tone, they can still do things to improve it?
Absolutely.
Wow.
It's like any other muscle group. You can strengthen and tone your pelvic floor muscles with regular exercise.
That's super empowering. It's like we have some control over this part of our bodies, even if it feels out of our control sometimes.
Absolutely. It's all about understanding your body.
Right.
And taking steps to feel more comfortable and confident. Kegels are something you can do on your own.
Okay.
But pelvic floor physical therapy can provide a more personalized approach.
Okay.
It can also be really helpful for women who have experienced pelvic floor trauma or dysfunction.
So if someone's concerned about vaginal laxity, those are two options they can explore.
It's always a good idea to consult with a healthcare professional to determine the best course of action.
Yeah.
But Kegels and pelvic floor therapy are definitely worth discussing.
I'm starting to realize that there's so much more to vaginal health than just size.
Right.
It's a whole system that plays a crucial role in our overall well-being.
You're so right.
Yeah.
And that's why it's so important to have these open and honest conversations.
For sure.
The more we understand about our bodies, the better equipped we are to take care of ourselves and make informed choices.
Okay, I feel like we've covered a lot of ground here.
Yeah.
We've talked about averages, debunked some persistent myths, and even explored ways to strengthen and support our pelvic floor health.
I think you've summed it up perfectly.
Okay, but before we wrap up, I want to circle back to something we touched on earlier.
Right.
This idea that focusing on averages can be misleading.
Absolutely.
Yes, please tell me more about that.
When we get fixated on averages, it's easy to start viewing them as ideals.
Right.
Which can lead to unnecessary anxiety and self-doubt.
Totally.
It's important to remember that bodies come in all shapes and sizes, and there's no right way to be.
I love that reminder.
Yeah.
It's like we're all unique snowflakes.
Yeah.
Even when it comes to our most intimate parts.
Exactly. And celebrating that diversity is key to embracing our bodies.
Yeah.
And experiencing true pleasure and intimacy.
So true. You've really given us a lot to think about.
Well, thank you.
I feel like I've learned so much from this deep dive. I think our listeners are going to
I hope so.
Love this.
Yeah.
Okay, before we finish up,
yeah.
Any final thoughts you want to share?
Yeah, any other thoughts? I think for me, the biggest takeaway is knowledge really is power. The more we understand about our bodies, the less we're ruled by, fear and insecurity. So much of what we've talked about today stems from, societal pressures and expectations that, frankly, don't serve anyone.
And it can be so hard to break free from those messages.
It can.
Especially when it comes to something as personal as our bodies and sexuality.
Absolutely. But, this deep dive, exploring these topics, it's a step in the right direction. It's about reclaiming our bodies, understanding them, and celebrating them in all their diversity.
So if you're listening to this, I have a question for you.
Okay.
Now that you know more about vaginal length, how does this change your perspective?
That's such a great question to leave our listener with. I think it's really about shifting our focus, isn't it?
Totally. It's about moving away from comparisons and anxieties and toward a more holistic understanding of ourselves and our partners.
And remembering the true pleasure and intimacy come from connection, communication, and mutual respect.
Beautifully said.
Thank you.
I think we've reached the end of our deep dive into vaginal length.
I agree.
I hope you found this as eye-opening as we did.
I certainly did. It's been a fascinating journey.
Me too. And remember, there's always more to learn and explore.
Right.
Keep asking questions. Keep challenging those societal norms. And most importantly, be kind to yourselves.
Yes.
Until next time.